With leaky gut, can you eat pea protein? Yeah, you can eat pea protein provided it's organic, provided it doesn't have a bunch of preservatives and other chemicals in it, and provided you're not reactive to peas. So yeah, that's a good question, Lynn. What's my opinion regarding the best thyroid medicine for a person with Hashimoto's? It's different for different people, Susan. The best thing to do is work with your prescribing doctor. I would say I would be cautious about certain medicines. If you know you're gluten sensitive, for example, certain medicines contain grain-based fillers that for many people with gluten issues don't do well with. So those would obviously be, conversations you'd want to have in deeper with your doctor. One of the things you can do though is look at the inactive ingredient list on your drugs, on your medicines. If you see things that you're reactive to, you want to talk to your doctor about getting that compounded. A compounded formula would be the adequate answer or the right answer in that regard. Are goat dairy products less inflammatory than cow dairy? Depends, Ronald, whether or not you're allergic to dairy. Some people are just allergic to dairy, and it has nothing to do with whether it's goat or cow so much. Although there are some that say that goat is more tolerated than cow. I would argue that it has to do with what we feed the animals, and it has to do with the type of animals that we're raising and how we raise those animals, because the quality of the milk is going to be a reflection of the quality of the care that is taken to give that animal life and again to feed that animal, to the stress levels of the animal, etc. When on antibiotics for 7 days for a UTI, does this cause inflammation if the first time is about 20 plus years? Look, if you've taken an antibiotic because you had a urinary tract infection that was severe enough that your doctor thought you needed an antibiotic, that's not what we're talking about tonight, okay? Using an antibiotic once, unless you just have a really severe reaction to the antibiotic, like an allergic response or a tendinopathy type of response, most people are going to tolerate a 7-day course of antibiotics. Look, if the infection's bad enough that it prevents you from getting a kidney infection and an antibiotic is needed, then there's nothing necessarily wrong with that. What I would suggest, though, is that if you're on that antibiotic, that you follow that up with a really strong dose of probiotic to try to help support the recolonization of your GI tract with a number of those species of healthy bacteria that can play a role in how your gut functions. Because definitely antibiotic, where people get into trouble is they go in every week for a doctor visit, and everything, the doctor's throwing antibiotics at them all day long, right? Just every time they go in. And so they have this chronic antibiotic use, but they don't have a justification to do it that way. Okay. Still can't seem to get the inflammation down. Went from my stomach, from the gut bacteria to leaky gut. Now my joints are swelling. Fastest and most potent things to take or increase, if already taking, to get the inflammation down. My experience, kind of the 1-2 punch that I like to see support like a really good inflammatory response would be mixing vitamin C with quercetin. And the issue here is most people, when they do that, they don't get it in high enough quantities. My experience is to do vitamin C and quercetin together to be meaningful and to be potentially impactful. Let's see. Let's go one more. Here we go. Quercetin and vitamin C, and you need about 5 grams. And this number can go up depending on the person, and you need anywhere from 4 to 6 grams a day. And these are kind of, think of these as 2 very, very powerful nutrients that work synergistically together to help with that inflammatory response. Grandson is suffering terribly with acne, 19 years of age. Could leaky gut have anything to do with the acne? It's possible. A lot of things can cause acne. Elaine, I would encourage you, we did a cross, let's see, it was about a month ago. Maybe it was a crash course on everything acne. And I would encourage you to go pull that up from our video archives and send that to your grandson, because there are a lot of things that can contribute to that. Leaky gut being one of them, of course. Okay, so Diane wants to know, if you're going to have surgery and they're going to give you 1 dose of antibiotics, would it be good to use your immune shield powder before the surgery? I've used it in the past for a leaky gut and it worked great. I mean, you can, more than using like immune shield for an antibiotic, I would look at using high dose probiotic. One of my favorite formulations is Ultrabiotic Defense. And this is very, very high dose probiotic, very, very rich in bifido and lactobacillus. Can be very, very helpful, post that antibiotic. Now, if you're talking about surgery recovery, if you want to do some things nutritionally to support recovering from surgery, there are a few key things that I can also recommend there. And one of them is we have something called BCAAs. Branch chain amino acids. These amino acids are very important for healing and repair. So remember, surgery is scheduled trauma, so they're cutting you open, right? And you want to have all the right ingredients, essential nutrients that your body needs in order to heal and repair from that scheduled trauma. So BCAAs coupled with L-glutamine and vitamin C. And so, again, 5 a day, 5 grams. And I would do this for at least, you can do these things. These things is a lot of times doctors will tell you before your surgery not to take certain vitamins or minerals or herbals because they thin the blood and they don't want you coming into a surgery with your blood too thin. I don't disagree with that. None of these things will thin your blood. So these are perfectly fine and safe to take before a surgery. And if you start taking them about 2 weeks before the surgery and take them through about 6 weeks after the surgery, these 3 things actually can help your body, help give your body what it needs to heal and repair. As a matter of fact, when I was going through grad school and working in one of the hospitals, one of the things that they would do is they would IV. And it wasn't all 3 of these things, but IV the glutamine. And in the patients that received the IV glutamine therapy post-surgery, and this was post-surgery, but also it was in a burn unit, so these were also burn victims, their wounds would heal about twice as fast using that. So again, these can be taken orally to support your recovery post-surgically as well. So it's not just the antibiotic that oftentimes doctors give. If they give you an antibiotic pre-surgery as a preventative, this is something I would recommend to offset that. But if you're going to go in and if it's an invasive surgery, particularly, these things are going to help support you and your capacity for making a recovery. Okay, let's see here. Checking in. What food sensitivity tests do you recommend? Carolyn wants to know. It's not one test. That's the whole thing, Carolyn. They're different tests. You remember your body makes IgA, IgG, IgE, IgM. It also produces immune cell responses directly and something called a T cell response and complement. There's a lot of different ways that your body can react toward a food, and to test it comprehensively, in my opinion, is the best way to go, because a lot of these food allergy tests are only measuring one out of these different pathways. So you might get some things that are correct and accurate and help you, but you might also get big chunks that are missing. Like in essence, you may be reacting to a food in a different way, but because it wasn't measured, you don't even know that you're reacting to it. Because a lot of these reactions aren't acute. They're not like you eat the food and you break out in hives. They're delayed response. So what they do is they create generalized inflammation, and that inflammation over time, as what you eat causes inflammation instead of nourishment, it can slowly start breaking your body down and creating more and more symptoms and problems for you. Okay. Greetings from crazy Spain. Laura says it would be an amazing conversation for Dr. Cohen and myself to get together. I'd love to do that. Yeah, I agree. The toxicity burden of vaccines is another major issue. Too big of a topic to tackle tonight, but certainly, we go back to what we said about foods. Just eating real food alleviates a lot of the different chemical burdens that we're being exposed to today. Well, vaccines much in the same way. And those of you who don't know much or haven't really thought much about the whole vaccine issue, I know it's now more at the forefront than it's been in a long time because of COVID. I would encourage you to get educated. And one of the places you can really begin the process of getting educated about vaccines is checking out. There's a program, actually, I think it starts tomorrow, called The Truth About Vaccines. And it's not a pro or an anti-vax group per se. It's just an information gathering group. So they put on a pretty educational, we'll call it a docu-series on the pros, the cons, the risks, the benefits, and all of that. And they bring together a lot of the world-leading experts from both sides to kind of entertain what you should understand so that you can make an informed decision. I think more than anything else, we all just want to have the freedom to choose what we believe is right for us and not necessarily be coerced or forced or told to do something against our wishes or against our will for the good of the whole, because that's not, what's for the good of the whole is not necessarily for the good of humanity. Not all the time anyway. Let's see. Thank you in advance. With having leaky gut, how would you treat a very, very sluggish bowel movement? I'm talking about as slow as once per week. So, Michael, that's a really good question. And to be clear, if you're having one bowel movement a week, it's not how would you treat it. It's why are you having one bowel movement a week? And there are so many different possibilities to why you might have a sluggish bowel. The number one thing I would encourage you to do, Michael, is get a copy of No Grain, No Pain. And this is just, again, for the sake of being generic, because we don't have time, and nor do I have the ability to get a full history and everything that would be pertinent to understand about you to give you an exact answer. But the book itself, Phase 1 and Phase 2 Diet, might change that for you. If you haven't already started it, I would encourage you to start that diet, because that's what a lot of people report back to us is their chronic constipation issues went away after they changed how they ate. And so that would be the first place to start. Is it safe for diabetic to supplement with super silica drops? I don't know why it would be dangerous. I mean, unless you were reacting to an ingredient in the supplement itself. But, you don't necessarily need to put silica in your water, although some people use it. Silicate pulls aluminum from the body. It's a really good detoxifier. So some people add it to their water. Juan wants to know what's better than activated charcoal for binding phosphorus. Already taking niacin, hopefully lower my phosphorus levels. I'd say, why are you trying to? First, I would say before taking a bunch of binders, I would ask a different question, Juan, which is, why is your phosphorus high in the first place? That would be, to me, the more important question to answer, or to ask and then answer. Okay, let's scroll down here. Adrian, does leaky gut cause asthmatic-like symptoms in the middle of the night? I've been having acid reflux, which seems to be caused daily, asthmatic spasms. I've seen, there's leaky gut, and yes, I've seen it in people when it was present. I've seen it create or contribute to, pulmonary issues, including asthma-like symptoms. But there's also leaky lung. And so, a lot of times with asthma-like symptoms, especially in the middle of the night, some things you might consider. And again, this might not be the solution for you, but it might be just some things if you haven't already considered. Where's the vent blowing? A lot of people sleep on a bed and the vent's blowing right at their mouth. And if you've got mold in your house, that mold circulating and that vent's blowing right on you all night, that could actually, I've seen that be a problem for some people, flaring up their airways in the middle of the night. And that's why it happens in the middle of the night, because they were lying there having that air just blown on them consistently. Let's see here. Without consuming any dairy, nuts, seeds, or supplements, what would you recommend to be a practical daily whole food diet to get sufficient calcium. So if you're not eating nuts or seeds, I mean, there's certainly calcium in vegetarian-based foods. I mean, broccoli has calcium, spinach has calcium. Now, it's harder to get to that calcium because of the phytate binding. And so cooking the food down really well can help free up some of that calcium. But beyond that, bone meal, if you want to use bone meal in soups or stews, pressure cooked fish, because the bones, you can pressure cook them in the fish and you can eat the whole bone and it's soft. Actually, if you ever eaten canned salmon, the little tiny bones in there, you can actually, they're a little crunchy, they're soft, crunchy, so to speak, very, very rich in calcium. So those things are all potential options to get calcium in the diet. Is colostrum effective for leaky gut if you have no problem with dairy? Can be, but even more than colostrum, I like Immune Shield. Immune Shield, somebody mentioned it earlier, so I'll just bring it up here. Immune Shield is non-dairy antibody powder derived from blood. So it's serum derived antibody proteins, and the strength of it compared to colostrum is much stronger, and that's one of the reasons why I prefer it. Let's see here. Can the cause of non-alcoholic fatty liver, can this be the cause of non-alcoholic fatty liver if you're celiac? So there's actually a lot of correlation, Lori, between celiac disease and NAFL or non-alcoholic fatty liver disease, meaning that we know that gluten has been shown to cause that. I've actually seen several people have come to see me over the years with non-alcoholic fatty liver disease and autoimmune hepatitis, and the reason why they were struggling was they were continuing to consume gluten. And so the gluten was actually the culprit. And so alleviating or making that change in the diet, for those individuals led to remission, even after their doctors or specialists told them that they would have to be on immunosuppressants for the rest of their life to preserve their liver function. So I'm a big fan of the diet. And yes, it absolutely can contribute to liver damage. Melissa says, I'm in the trap, the medication trap I was talking about earlier. If you have your copy of Melissa of No Grain, No Pain, I talk about that. It's called the prescription pain trap, and get your copy and go read more about it and break through that trap. It's easy enough to do. So Pauline, I can't give you, drug advice. So you're asking me if it's okay. You've taken Histacyst for your allergies to help with urticaria, and you have an appointment with your dermatologist on Wednesday. Is it okay to take the steroid if he suggests that? But I can't tell you yes or no to answer that question. It's really a conversation you need to have with the doctor. Just knowing and understanding the side effects of steroids, though, is going to allow you to have a more intelligent conversation and open up the floor to ask the right questions. Okay, let's see. Scroll down on that left side for me too. What kind of rice is safe to eat? Kalapi wants to know. Wild rice is safe to eat. If you're following No Grain, No Pain, wild rice is the only form of rice that I would recommend that you attempt in your diet. Okay, what is modified starch? Modified starch can be a lot of things. It could be potato starch. It could be tapioca starch. It could be wheat starch. So when you see the term modified starch on a food label, you always want to, if you're not sure and you're trying to avoid certain things, always call the manufacturer of the food product and ask them where the starch is derived from. And that way you get a clarity so that you don't accidentally get exposure to something you shouldn't. Okay. Maltodextrose, another question on food additives. Maltodextrose is a food additive. It's a sugar, basically. It's a sugar, and for many people, maltodextrose has been shown to cause a disruption or problems within the GI tract itself. It also, but beyond that, it drives up blood sugar and creates a glycation effect in the bloodstream, which can contribute to metabolic syndrome and diabetes and all the other problems that go along with elevations in blood sugar. Christina, I hope I say your name right. Christina wants to know if you can test for leaky gut or you just go by symptoms. The problem, Christina, with testing for leaky gut is the tests aren't super accurate. So where some tests are measuring whether or not certain types of sugars are showing up after you've consumed them. And some tests are measuring different types of proteins that might mean you have leaky gut. None of the tests for leaky gut are super, super definitive. And so relying on any one of them is not a great idea. Now, working with a good practitioner who understands the nuance of this would be my best advice to give you, so that if there may be more than one type of test that they're going to want to run to help try to make that determination for you. But there's no one great test that's going to measure leaky gut and be 100% accurate for you every time. So that's a great question. Tracy wants to know, how do you know when leaky gut is healed? Generally speaking, when you're vibrant, when you're healthy, and when you're asymptomatic, I'm less worried about whether or not a person has a leaky gut. If they feel really good or have lots of energy, sleep really well, have a clean diet, get adequate exercise and sunshine, and drink clean water and breathe clean air. So if you're not struggling in your health in any way, I'm not saying that you can't ever get sick or that you can't ever feel under the weather. That's not what I'm talking about. Everybody has a bad day. But if you're having consistently more bad days than good days in your health, and if you have a diagnosis of autoimmune disease of any form, and remember, the different forms of autoimmune disease are quite vast. It's now believed that most forms of autoimmune disease actually start from leaky gut, meaning intestinal permeability is the kind of the pre-trigger that happens before the autoimmune disease develops. And one of the reasons why it's so challenging with autoimmune disease is because leaky gut can be pervasive, and it can be going on for 10, 15, 20 years, and the symptoms build and build and build and build before a disease formally gets diagnosed. Because a lot of your autoimmune diseases, it can take 3 decades to get a diagnosis. It's because there's no great medical specialty in autoimmunity, because it's just not a topic that is kind of teased out in medical school. Remember, autoimmune disease is it's 200 plus diseases, right, that affect multiple systems. And so most doctors who specialize in one field, the heart, right, or the thyroid, or pick your organ or pick your gland or pick your region, right? The skin doctor, the OB-GYN, et cetera. They hyper specialize in one area, and so they're not looking at autoimmune disease under the vast spectrum. And the symptoms early on of autoimmune disease, again, and also leaky gut, are rather not esoteric, but they're just not definitive. So, for example, brain fog, lots of fatigue, gas, bloating, constipation, irritable bowel, those types of things can happen early on, and they can go on for several years before they progressively get worse and manifest into a major type of disease. So what a lot of people do with some of those minor symptoms for several years is they medicate them, which is what I was talking about earlier. They take, if they have a little joint ache or pain, they take a little bit of NSAIDs. If they have a rash starting to develop on the skin, they just rub a little steroid cream on it and it goes away. And again, if you follow that pattern out over years, that basically that leaky gut is allowed to continue to leak. And so the body is overcome by the systemic burden of basically poop and sludge leaking from your quarantined gut zone into your bloodstream directly, creating havoc and inflammation in your body. Do I approve of using sugar alcohols if you're celiac? Depends which one. So some sugar alcohols are derived from corn. I don't recommend those because there's some research that shows that corn actually, the form of gluten in corn, there was a study done in 2012, actually was shown to be more detrimental than wheat gluten for many celiacs. So I don't recommend corn or corn byproducts. And so some of those sugar alcohols are corn. But if, like xylitol from birchwood, I would say as long as you tolerate it well, you could certainly attempt to use it. So Debbie says, does that mean that hormone replacement therapy can cause leaky gut? It's certainly a question worth entertaining, and I've seen research that would suggest that it can, Debbie, and I actually did an entire show on that topic a few months ago, so you might want to go back in my video archives and pull that show up and watch it. Any suggestions for recovering after a cardioversion, electrical and medical for AFib? Lots of suggestions, and the first one would be diet change. If you haven't already, Elizabeth, make sure you're following the no grain, no pain diet because you want to be as anti-inflammatory as you can. The other would be follow up with your doctor and get nutritionally tested, because a lot of times AFib, I've seen AFib be a manifestation of magnesium deficiency. I've seen it be a manifestation of electrolyte imbalance. I've seen it be a manifestation of gut imbalances. So things in the gut, bacteria and other things in the gut that are out of control or that are imbalanced, creating or contributing to that. So you have to be proactive with that if you want to recover well. Let's see. It was gluten-free AIP diet for over a year. My food sensitivities has continued to get worse. What do you recommend? Very, you got to get with somebody, get with an expert, get with a professional, and get help. That's what I recommend, because there's not going to be a magic bullet solution I can give you if you followed that type of diet for over a year and didn't get any better but got worse. You need specificity. I've seen people who are on a paleo diet who were allergic to coconut, who were allergic to beef, who were allergic to the things that are heavy on the paleo diet, and it was just continuing to pummel them. And so that may have been, or that may be your case as well. Yeah, Lisa says, I have that book. Maybe I should pick it up and read it. Yeah, it'd be a good idea, right? Knowledge without application is wasted. And so that's kind of a cardinal rule. If you've got the book, you've got the knowledge in your hand. But if you don't apply it, then it doesn't matter. You can have the knowledge, but again, without application, it kind of sits on the shelf and gets dusty. Let's see. So if somebody's asking about Cape aloe for constipation and they had a colonoscopy that showed melanosis, can Cape aloe contribute to melanosis? It can if you're using it on a regular basis. If you're using it occasionally, define occasionally. If you're using it once a week or every once in a while, no, it shouldn't be what's contributing to that at all. Okay, go down a little bit more there. Sprouted bread have gluten? Yes, Jackie, sprouted bread has gluten for sure. A lot of people go to the sprouted breads because of the perceived health benefits. But if you're gluten sensitive, going to sprouted breads is a bad idea for you. Okay. I think I got most of them. We're hitting the timeline here. So last question I'll answer. What test to measure SIBO? And there's a gas test that, where you blow hydrogen and methane. So using a breath test would be probably one of the more accurate ways to look to determine whether or not you have a small intestinal bacterial overgrowth. So get with your doctor and ask them about that type of testing, and that might be helpful for you to get an answer. Okay. Again, make sure you tune in next week. We're going to be talking about part 2. Tonight we talked about causation. We talked about the triggers, what you need to understand that can actually potentially trigger a leaky gut. Next week we're going to be talking about the solutions, what you can do to overcome it. So make sure you don't miss that show in this 2-part series on the most common asked question in health today. Hope you have a fantastic week. We'll see you next Monday, same time, for another episode of Pick Dr. Osborne's Brain. Take care. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.